It is in this special article that we analyze the severity and the trend of COVID-19 every month. Today, we focus on the month of November, which according to the Health Cabinet Secretary Mutahi Kagwe was the worst affected month. Keep in mind that he made a similar depiction in the month of October, a clear indication that this pandemic continues to cause more harm in the nation. According to Cumulative Statistics, 27,413 cases were confirmed in the month of November up until the 28th, which marks 4 weeks. Up until the same date, cumulative infections in the country tallied up to 82,605, dividing the infections in November by the nationwide infections and multiplying by 100 states that 33.2% of the country's infections are in the month of November. Here now is a weekly breakdown of the over 25,000 cases in November. In the first week, 6,577 individuals contracted the virus, 107 succumbed to the coronavirus disease, whereas 4,097 recovered. This data was disseminated by the Ministry of Health after a cumulative 42,662 samples were tested.
These are Kenyans from all walks of life, politicians, priests, policemen, teachers.
The second week turned out to be a particularly sad week for the health sector after 4 doctors lost their lives to COVID-19 in less than 24 hours. Up until now, over 30 doctors have succumbed to COVID-19. These are the names of the 10 senior specialist doctors who will unfortunately not offer their services to over 100,000 Kenyans. The reason as to why I put it this way is because our country's current doctor-to-patient ratio is 1:10,000, contrary to the ratio advised by the World Health Organization, which is 1:1,000. As a result of their fatalities, among other issues, tension has erupted between various health bodies and the national government. Following these, doctors, nurses and health workers in general might on this coming Sunday, the 6th of December 2020, down their tools across all health facilities in the country. The big question is, what does this make of the month of December, if November has been termed as the worst month, even with the overstretched health services provision?
Of the 274 dead, 8 are medical doctors. And these are people who have dedicated their lives to save the lives of the majority of us.
We are the soldiers in this war. And if you issue orders against this notice, then that order shall be a piece of paper.
According to statistics, in the second week of November 2020, infections increased by close to 1,000, bringing the week's tally to 7,504. Fatalities, on the other hand, went up by 39. Recoveries as well increased by 257 individuals. Moving on to the third week, Health Cabinet Secretary Mutahi Kagwe pointed out that the severity of the virus was not slowing down, a statement that was elaborated by Health Chief Administrative Secretary Mercy Mwangangi, stating that the country's positivity rate was fluctuating between 14 and 20%. This is far from the required 5% positivity rate for 2 consecutive weeks by the World Health Organization.
Our numbers have been rising at an alarming rate.
Speaking of positivity rate, the higher it goes, the more the infections are recorded. This then takes us back to the doctor-to-patient ratio. If this happens to be our trend in the near future, we might soon overwhelm the healthcare capacity in the country.
Doctors in parastatals, Kenyatta National Hospital, Kenyatta University and Referral Hospital, Moi Teaching and Referral Hospital have been excluded. So on that note, we know that the government has come out to say they've provided that if these doctors are not covered, then this strike will kick off.
In the last week of November 2020, there was a significant drop in the new infections by 930, fatalities by 38, recoveries by 2,891, and samples tested by 2,693. However, this does not dismiss the fact that Dr. Mercy Mwangangi revealed information of Kenyans who were apprehended at the airport attempting to travel abroad with invalid COVID-19 certificates. Now, these are not imported certificates, but locally produced, regardless of the raft of preventive measures often put out by the Ministry of Health. This also demeans the strategies outlined by President Uhuru Kenyatta on the 4th of this month, with the sole aim of preventing the nation from collapsing as a result of widespread of the virus. Being the last day of November 2020, this analysis reveals that personal responsibility is key. because the COVID-19 pandemic will not fade away anytime soon. Until next month, a time like this, with hopefully good news, I wish you a happy new month. My name is Ben Kirera.